Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When you are called upon, we will unmute your microphone, and then you also will have to unmute your own microphone.
Good afternoon. Thank you for joining us on another Wednesday at 2:30. Got a full program today, so we'll get right at it. Probably should say Happy New Year in advance, or Happier New Year, I'm sure of that. I think that's a safe comment to make. But we do have Dr. Box's report. We'll have Dr. Weaver on a vaccination update. We'll have Dr. Sullivan, Jennifer Sullivan, who will be giving us some helpful tips as we go into yet another holiday period on some folks on how you can help your neighbors who are in need in their struggles. We also have a special guest. Senator Mike Braun is with us today. We had Senator Young with us last week, and Senator Braun will be able to even focus and dive deeper into how the latest federal package will help on Main Street here in the state of Indiana, really across the country, but specifically for our purposes here in the state of Indiana. And then Senator Braun will be able to stay with us to answer questions, as did Senator Young last week. So we'll get right at it. We are extending, I'll be extending the current executive order for another 3 weeks. It will stay for the most part the same as before. However, we have made one update. We'll continue to, stress all the best practices that need to be adhered to and followed, masking up and physically distancing when you cannot, and make sure that we're doing everything that we can to mitigate the spread. But on top of that, we've been in close contact, daily contact, more than daily contact with our hospital association, with independent and individual hospitals all over the state of Indiana. You'll recall in the previous executive order, we said we were going to halt some of the non-emergent or urgent, or not urgent, but non-emergent elective procedures in the hospitals. And we put a pause on that. We had a real stress and strain on our network statewide. That has improved. The numbers have improved a bit. There is stress and strain there for sure, but it has improved, and we've again worked with our hospitals, worked with individual hospitals, and they have requested and assured us that they can continue to manage going forward. So we will lift that, and there won't be a pause moving forward. Now, I say that today, but we monitor these numbers again every day, every week. And so while there's an executive order out there that goes 3 weeks, we're going to be reviewing this tomorrow and the next day, whether it's a holiday or not, and track and follow that ebb and flow of the cases. And so that's the biggest update to the executive order, again, that we'll be going through the 24th of January. Also, something that will look a little different, we have a wonderful tradition here in the state of Indiana that on the first day of the year, all of our state parks, a lot of folks go out and they go on organized trail runs, trail walks, trail rides throughout the state of Indiana. Of course, we're not going to be bunching people up. Doctor said so. We're not going to be bunching people up as you're blazing your trail in 2021 on January 1st. But we do encourage Hoosiers to get out there and get on, blaze your own trail. And our parks, the DNR has gone to some extra links to create some, not just stickers that you would have received in years past, but also some resolutions along the way, some signage along the way about the upcoming year. And I won't ask you what your New Year's resolutions are going to be, but mine entail eating, sleeping, and exercising. But that's the true every year. Mm-hmm. So with that, would you give us our weekly updates?
Thank you, Governor. Good afternoon, Hoosiers. This is a time of year when typically, as the Governor says, we reflect on that year and what it has brought us. And as I look back on 2020, this has been a year like no other, not just for us in public health or healthcare or state government, but for every Hoosier. We've lost people we love. We've sacrificed to keep others safe. We've seen livelihoods disappear. We've learned to work and teach remotely. And we've adopted behaviors that we would never have thought we could have imagined needing, such as wearing our masks and practicing social distancing. I know many Hoosiers are going into 2021 without the hope or excitement that we often associate with our new year. There's no doubt that we can carry many of the burdens of 2020 into the next year. But even as I go over these numbers today, I want to remind you all that there is hope. And we are excited to see the things changing and the vaccine to be here and being vaccinated in individuals' arms. The vaccine has begun arriving and thousands of Hoosiers are receiving their first doses. I personally had the privilege this week of vaccinating some of our frontline healthcare department workers who are leading this response. These are the people that have worked 7 days a week for months to bring you testing and now vaccine, and keeping them healthy is critical to the success of Indiana's vaccine efforts. Doing that gave me confidence that we will have a new story to tell a year from now, and I believe it will be one of hope renewed. But until then, we need to hang tough. To renew that hope, we need to listen to what the data shows us and act accordingly. The number of new cases this week has declined from what we have seen in recent weeks. However, it's too soon to say that we have turned a corner, and we do expect that the number of cases are going to bounce back up in the coming weeks. December saw the lower testing numbers than we had experienced in some time. While some testing sites opened for brief times over the holidays, many were closed. Labs did continue to run, and the brief closures do not account for the significant drop in testing. We continue to have nearly 280 testing site locations across the state. In fact, we saw a flurry of activity right before Christmas when people were trying to get tested in time to have their results back so that they could show their family that they were negative. I want to encourage any Hoosier who is at risk or may have been exposed to get tested so that you can take appropriate actions to protect yourself and those around you. Knowledge in this situation truly is power. You can save lives, maybe even your own. As we look at our numbers this week, we've seen a slight drop in the COVID-19 hospital census over the last week. It's gratifying to see the numbers go down, but we need to remain vigilant. Nearly 3,000 Hoosiers are still currently hospitalized with this disease. As I've said with other holidays, we know that holiday gatherings or travel could contribute to another increase. I saw many accounts of people who did Zoom Christmases and dropped off presents on the porches of family members instead of having traditional gatherings. But while air travel has been down about 60% nationwide, TSA is still reporting that more than 8 million people went through airports around the country between December the 21st and December the 28th. That amounts to a lot of potential exposures, and we'll be watching our case counts closely over the next couple of weeks. We also had almost 400 people admitted for COVID or COVID-like symptoms on December the 23rd, which remains on the upper end of our daily admissions that we've seen throughout this pandemic. So in case there was any doubt, we are far from being out of the woods. We continue to lose Hoosiers to this disease daily. Today we reported 109 deaths, and we've seen more than 350 Hoosiers lose their lives to COVID this week. That brings our total losses due to this pandemic to more than 8,100 Hoosiers when you include the probable deaths that have been reported based on clinical diagnosis. Please do not get numb to these numbers. These are our friends, our family members, and our neighbors. We owe it to them to continue to do the work that is needed until we can vaccinate the majority of our state. I also want to show you the updates on our dashboard and color-coded county maps that I mentioned last week. Today's dashboard reflects the correction to the software that incorrectly calculated the statewide positivity rate. As I noted last week, this has led to an overall increase in our statewide positivity rate by about 2%. The rates today also reflect changes in how we calculate the positivity rate for the week. Previously, we added each day's positivity rate for 7 days and divided by 7 to obtain the week's positivity rate. Starting today, we're adding all the positive tests for the week and dividing by the total tests done that week to determine the week's positivity rate. This will minimize the effect that a high variability in the number of tests done each day can have on the week's overall positivity, especially in our smaller counties. As a result of the correction and change in the methodology, our statewide positivity rate for all tests is now 13.7%. It was 11.8% on Tuesday under the old formula. The graph that you're looking at right now basically shows you the curve in the blue or the darker color, which is the way we used to calculate this, not only with the error in our software, but also with the different method of calculating our percent positivity for the week. Now, the yellow curve shows you the new way that we are calculating this with the error corrected in the software and also with our new method of calculating the 7-day positivity rate. I think it's important to notice that the graph in both of these ways we calculated it is the same. So the curve remains very, very similar. This week, 45 counties are in red and only 1 is in yellow. The rest are orange. The advisory map is a guideline for when a county can move to a lower tier of restrictions. A county must remain in a lower color for 2 consecutive weeks to adopt the lower color requirements. I want to repeat what I said last week. We have confirmed that the number of cases per 100,000, the positive tests that we have sent to our contact tracers, our deaths, and our overall test counts were not impacted by this change. Finally, I want to share the CDC's guidance about New Year's Eve with you. By now, much of this guidance will be familiar because it's similar to what we've shared for other holiday celebrations. I'm sure many of us would like to put this year behind us. There are ways to ring in the new year without putting yourself or others at risk. Those include having a celebration with members of your immediate household, calling friends and families to count the new year together, or even planning a neighborhood countdown at midnight where people stand on the front of their homes or in the streets and cheer at midnight. The safest way to mark the end to 2020 is by staying home with your own family. And if we all do that, we will have a much brighter 2021. And now on that note, Dr. Weaver is going to provide some updates on where we are with vaccines.
Thank you, Dr. Box. I agree with you that we do have hope, and we do have excitement. I see it on the faces of my healthcare colleagues who are proudly posting pictures of themselves receiving their vaccines on social media, and in the clips of long-term care residents, our most vulnerable population, starting to receive their vaccines this week. I also see it in the emails I get from Hoosiers across the state who are asking, when will my turn come? I am excited to share that as of data pulled yesterday morning, nearly 76,000 Hoosiers have received their first dose of vaccine. More than 110,000 Hoosiers in total have scheduled appointments for vaccine through next Monday, and those numbers continue to grow. Those numbers do not include the estimated 40,000 doses that are set aside for our long-term care facility residents and staff. Today, we will also be launching a vaccine dashboard that shows the number of vaccines administered. That should be up by this evening and will be on our vaccine website. This is a snapshot of time, as data is reported and verified in our state immunization registry. We will be updating that each Wednesday going forward. By the end of this week, Indiana will have been allocated 146,250 doses of Pfizer vaccine and 152,500 doses of Moderna vaccine. That represents nearly 250,000 healthcare Hoosiers who can receive their first doses of vaccine to protect them from COVID-19, and another 40,000 directed to our long-term care. While it appears that we have a lot of extra vaccine, that really isn't the case. We received a sizable initial shipment of vaccine, but our weekly allocations will be lower going forward. We also had limited vaccination occurring over Christmas and again at the end of this week for the new year. But vaccines will be picking up as we get past the holidays. Between that and the lower allocations, we expect to absorb any excess over the next couple of weeks as we continue to vaccinate our healthcare workers. Over 100,000 additional healthcare providers have been invited this week, and more are coming out. We continue to focus our vaccination efforts on our frontline health workers because they are at the greatest risk of exposure. And as I mentioned, CVS and Walgreens have started their vaccination efforts in long-term care facilities this week. I want to stress that we are moving in a very intentional order of eligibility for vaccine. We want to ensure that we have enough vaccine before we open up vaccinations to additional groups. To date, no vaccine has gone to waste or expired. We have provided instructions to hospitals about who is eligible for the vaccine at this time. With the exception of residents of long-term care facilities, every person receiving the vaccine right now has to attest that they are a health worker who has had exposure to patients or infectious material. We ask that hospitals also verify work IDs or other forms of verification that they meet criteria before vaccinating individuals. And when we get reports of people who aren't eligible receiving the vaccine, we reach out to hospitals to repeat these instructions and answer questions. This is all designed to ensure that vaccine is available to those frontline health workers who are at greatest risk of exposure. These are the people who provide care in hospitals and long-term care facilities and who provide critical health functions such as testing, administering vaccine, and taking care of our patients in the outpatient world. We also want to continue to ensure that vaccine is not wasted. We have asked hospitals to have standby lists in case people who schedule appointments are unable to keep those appointments. This will help to ensure that we are getting vaccine in as many people as possible. For instance, if a person can't keep an appointment, there might be a patient-facing staff member in another part of the hospital who hasn't registered yet, or an unlicensed staff member in a clinic who encounters a patient. The goal is to get vaccine in the arms at the highest risk in our healthcare settings. We know many other people want to know when they can get the vaccine. Our external vaccine advisory committee met this week to review the latest federal advisory committee guidelines and Indiana data to help make the recommendations that best suit Indiana's needs. We hope to have those to share with you in the next week or so. As a reminder, the following questions are considered in developing these groups. What is the risk for serious illness and death in that population? What is the risk of exposure to COVID-19? What is the risk of exposing others, especially vulnerable people? And how much vaccine do we have available, and what is the safety and efficacy of that particular vaccine for that population? In the meantime, if you are a licensed healthcare worker who is currently practicing, your time to get vaccinated is now. We worked with Indiana Professional Licensing Agency to send additional invitations this week, so please check your email or with your employer to see if you're eligible at this time. We've also asked those licensed healthcare workers to share the link with their unlicensed healthcare providers in their facilities. The Professional Licensing Agency and healthcare associations will continue to push out those emails and notifications through next Tuesday. Thank you.
Thank you, Dr. Weaver. Next, we'll go to Dr. Sullivan. Dr. Sullivan, when it comes to our physical health, which we spend a lot of time talking about and providing updates on, and how we battle back and confront viruses and diseases. We talk a lot about vaccines and how that can provide immunity. When it comes to our mental health, a little bit different, but ever as important. And while vaccines can provide immunity, it's typically the case that we in a community is what provides that help with folks, whether it be ourselves, our loved ones, and maybe even as important, folks we don't even know yet. Can you spend as much time as you need, because it's that important, talking about, we've just come off of Thanksgiving, Christmas, the holiday, and we're going into a whole new year, and we've been through so much that's been taxing in so many different ways. Can you spend some time talking about how we can, the bottom line, help one another?
Absolutely. Thank you so much, Governor Holcomb, for having me here today. Today, I'd like to present what we've learned about the state of Hoosiers' mental health and steps you can take for yourself or your loved ones, even more so during this holiday season. Many are affected by COVID-19 itself, dealing with loss and fear. We're all afflicted with the mental health aspects of this pandemic. Disruption to our daily lives continues with recurrent needs for quarantine and isolation, changes to school and work schedules, unexpected illness of friends and family, and disruption to our social supports. These will be ongoing until our collective actions and the vaccine help us get things under control. Also, as we know, cold weather and less daylight, along with the holiday season, can be especially difficult for folks with existing mental health conditions or those undergoing acute stress, which honestly is all of us. The effects of COVID-19 are uncovering or exacerbating existing mental illnesses, minor or severe, that people didn't know they had. These need to be taken seriously and professional help sought. In April, Indiana launched BeWellIndiana.org, an online clearinghouse for mental health services and supports for Hoosiers. And one of the features of that site is a series of self-assessments for mental health issues offered by Mental Health America. There are 10 assessments to choose from, like depression, anxiety, eating disorders, or addictions. There is one general screening specifically for young people and another that parents can take to answer questions about their children. 25,000 Hoosiers have taken these self-screenings since April. More than half are under the age of 25. It's great that younger Hoosiers are taking an interest in their own mental health. We strongly encourage those in older age groups to take advantage of this too. 57% had not been previously diagnosed with a mental health condition and were not receiving any treatment at the time of their self-assessment. But for more than 3/4 of those taking the self-assessments, there was confirmation of a mental health diagnosis. In fact, more than half of all self-screenings in 2020 confirmed a moderate to severe presence of depression, bipolar disorder, or anxiety, the 3 top mental health issues related to suicide. When asked to identify what was contributing to their mental health problems, the top 3 responses were loneliness or isolation, past trauma, and relationship problems. What this says to me is that we have young people with new and serious mental health conditions. I certainly am seeing that in the pediatric emergency department where I work, and it breaks my heart. We have a responsibility and an opportunity to make sure that we support these individuals so that their mental health needs are met now and do not become chronic. We also launched the Be Well Crisis Helpline in July. Hoosiers can call 211 24 hours a day to talk to an experienced and compassionate counselor specially trained to help with the issues that have come along with the pandemic. This week, these counselors took their 6,000th call and to date have spent more than 1,700 hours in crisis counseling with our fellow Hoosiers. The majority of these callers are between 40 and 64 years of age. What we've discovered is that 46% of the callers have pre-existing trauma or substance use and mental health problems. Top distress reasons include, again, isolation and withdrawal, issues with sleep, or anxiety or fearfulness. Our crisis counselors have referred 29% of the callers to mental health treatment and helped connect more than 1,000 to resources such as food, clothing, housing support, or utility assistance. Some are referred to emergency crisis counseling as well. This means that thousands of our fellow Hoosiers have begun to receive treatment for the mental health issues they face and possibly faced prior to COVID-19 that have likely gotten worse because of the pandemic. So as we try to enjoy our holidays and enjoy them quite a bit differently this year, we encourage everyone to develop a strategy for mental health self-care. Loneliness and isolation are the top drivers of mental health challenges. Coming up with creative ways to connect with others is critical, even if it's through phone calls, FaceTime, Snapchat, or the old-fashioned holiday letter. Each of us should commit to connect. Even if you don't feel like you need to connect, the people you would be connecting with probably do. One of the things I started early in the pandemic days was writing a card or a postcard to one person almost every day. It helped me to remember how grateful I am for the people in my life, far and wide. I'm on my 10th book of stamps. But also, I didn't come up with that on my own. My therapist did. If you are alone, take time for some quiet, turn down the lights, and take deep breaths. Try to focus on what you can do rather than what you can't. It's also important to recognize that for some of us, self-care may not be enough. You should seek help. Go to bewellindiana.org. Watch the videos from Indiana mental health professionals about things like managing crises, recognizing depression, or helping kids cope with the challenges of COVID-19. You can also connect to treatment resources through this website. Call the Be Well Crisis Helpline. To do this, you call 211, and after entering your zip code, follow the prompts to reach the Be Well Crisis Helpline. You can also connect with a crisis text line by texting HOME, H-O-M-E, to 741-741. Find other numbers specific to domestic violence, suicide help, support for veterans, and more at bewellindiana.org. Also, don't forget to talk to your primary care physician who cares about you too. Please realize that it's okay to reach out for help and help others around you to get through this too. Encourage them to seek help through these resources. Know that it's okay not to be okay. The stigma surrounding mental health needs can keep us from the help that we need, but we can overcome that too, together. Thank you.
Jen, thank you. Really, really proud of you and your entire team. And you're making a huge difference. You're trying to make this as easy as possible in the hardest of times. And it's making a big difference. And I also thank you for not disconnecting from me on a daily basis. We've all become very connected. Little did we know it would be on an hourly or daily basis. But we're getting through it together, and that should extend to everyone in the state of Indiana. Our next guest has helped us do just that. Senator Braun comes from Main Street and was insistent that this latest federal package was rightly focused on how our federal partners could, and agencies, programs, et cetera, help Indiana's Main Street, not just weather, but get to the other side of this. Senator Braun, can you give us some updates and your perspective? I know it was a long and winding road to get to where we are, but this has made, I won't go into all the different categories, but this is going to make a huge difference for the state of Indiana to responsibly get to the other side of this. With that, the floor is yours.
Very good. Governor, I first of all want to give a shout out to you and your crew. It's been it's been a pleasure to see your state and many states tackle this in a way that has been probably looking somewhat cumbersome in terms of what we've been able to do here at the federal level. So kudos to you and everybody that has stayed in good communication with the public. I did a couple floor speeches way back in March that cited the challenge of this in terms of balancing public health, keeping the economy healthy. And regardless of what you may or may not try to do through government, it still requires that individual responsibility to do some of the basics that we were all told to do from the get-go. And I often refer to a place like Indiana. I wish we had some of the disciplines, some of the mechanics out here. All along, I was interested in trying to put the most resources into the places most impacted. And of course, as we've seen this whole journey unfurl, it's been a disease that's shown peculiarities along the way to where you think you might have one approach that's working, but I think the key is to be disciplined with the few things that we know have worked over the way. What we got into out here, sadly, was an argument that had many political elements to it. And sometimes I know it had to be frustrating for Hoosiers, Americans across the country. What are we doing? Quick context on what most recently transpired. Every year we do a funding bill. It ends up being called the omnibus bill. We should have that done by September 30th. That's the end of our fiscal year. Yes, that would have been roughly 3 months ago. So you know how important budgets are, and out here we don't do them anymore, and we don't even do the appropriations for the fiscal year until we're into it. It got complicated this time because it got all rolled up into one. The COVID relief package was being confused with the omnibus spending bill. Most of what you heard in terms of the pork barrel spending and the stuff that you'd never get by with back in a place that's disciplined like Indiana, that was in our normal spending bill. And the way politicians have evolved out here, you end up doing it at the last moment. It got all put together. So what I'm going to focus on is what we actually did in the COVID relief bill. The PPP, Paycheck Protection Plan, which I, back in March, was part of that group that tried to craft it in a way that would make sense for small businesses. Of course, the threshold was 500 employees in the CARES Act. It's 300 now, but we've revived a lot of that. The issue that I heard most often is how do I spend the money so that when we get to the finish line, it's going to be forgivable. That, if you have any questions, make sure any business that contacts your office gets a hold of mine if you can't give them the information we need. We've got a great team here that's delved into every detail and aspect of it. You can get onto the website at braun.senate.gov, but I welcome anyone, if you're in doubt at all, business or individual, to get a hold of somebody on my crew. That was a popular plan. Talked to many businesses. Had they not had it, they would not have made it through. So that has been re-upped. The threshold level is now 300 employees, not 500, to further target it towards Main Street, and especially to do everything we've been doing in this last package for the 4 or 5 sectors of the economy that have been disproportionately impacted. And in almost every state, that would be sports and entertainment venues. Their businesses have actually been almost non-existent, other than what you might do with no fans and TV. Airlines came in on a flight from Louisville today, 143 seats, 143 passengers. And airlines, like most businesses, and I think they need to be applauded, have been following the rules. There's been hardly any transmission noted on airlines. I think that's going to give the confidence for people to start flying. They're still off 40, 50, 60%, but they're gaining ground. Downtown hotels, the hospitality industry is still hurting, and of course, restaurants. In fact, I thought there should be particular aid aimed at restaurants. There's a little bit of that differentiates in like some of the stuff we've done, but that is the sector employs the most people in the country that has been hurt so badly by this fickle disease that we're all confronting. So in a nutshell, that is back out there. You also will have the deductibility of any expenses. That was being ruled by the IRS to where you'd have forgivability on your loan if you adhered to the guidelines, but then you could not deduct your expenses. Senator John Cornyn and I were adamant about that being in the current COVID relief package. A lot of businesses may have questions about that. So on PPP, make sure any questions, any complications, engage my office. Direct payments. Direct payments are $600 up to an income threshold of $75,000 individually, $150,000 for a couple, $600 as well for anybody at home under 17 years of age. That was popular back then. Of course, you know that there's a discussion ongoing that we'll be haggling on over the next couple days up here, whether we do more than that, but that's what went through with what passed that the president signed a few days ago. By the way, if you've got a direct deposit account, some of those should be hitting within the next day or so. So we know the urgency. Again, if you run into any issues, make sure you contact my office so we can follow up on whether it's been sent out. Enhanced unemployment benefit, $300 a week. That will continue through March 21st. And then there's a lot of other particular help. I won't go into the details. It's all on the website. There's help for agriculture. There's help for schools. We tried to pick this time around to focus it in as targeted a way as we could. That squabble over how much we were going to do in a targeted basis and then trying to get rid of the extraneous stuff, again, was what delayed it, just like it did back in March, 3 to 3.5 days. So I was glad we got it across the finish line. Sadly, we do not operate our budget and finances like you do back in Indiana. We have to borrow every penny that we're putting into it. We do that routinely now as part of our budgeting and lack of it in running trillion-dollar deficits. But we all know that this is a once-in-a-lifetime occurrence, and you needed government to step in because in many cases, a lot of businesses and employees were struggling because of the rules that we're trying to put into place to tamp the disease back. So I'll let it at that and be happy to answer any questions. I have someone on staff with me that if it gets to be something too detailed, we'll still try to answer it. If not, make sure you follow up with us.
Thank you, Senator Braun, and thanks for staying with us through the Q&A portion. We also have Dr. Dan is with us in another room. Fred Payne with the Department of Workforce Development is with us. Chris Johnston at the Office of Management and Budget. And again, Senator Braun is going to stay with us. Rachel?
Abdul Hakim Shabazz, Indy Politics.
Abdul, good afternoon.
Good afternoon, Governor, and Happy New Year to you and Dr. Box and all your staff. We really do appreciate, I think I speak for all of us media folks, these things you've been doing since March. So thank you very much. Hopefully you don't have to do as many in 2021.
I'm taking your word for it. It is going to be a happy new year.
Just throwing that out there. A couple of questions. What would you say, speaking of 2020, I know Dr. Box, you can chime in on this as well, is your proudest moment dealing with the pandemic and your most disappointing moment dealing with the pandemic?
Well, I'll go first. I'll try to buy you some time. I would say the proudest moment looking back, which I don't typically like to do, and we're not through this yet, so there'll be a day for that, is that we've stuck together. And I'm not just referring to our team here at the state of Indiana. We are stuck together with adhesive. But really, the state of Indiana has stuck together, and there are a lot of silver linings. There are a lot of glimmers of hope out there, not just the vaccine, but when you do look back for the state, getting reports that we've had plus 20,000 people move into the state of Indiana in 2020, that we're an in-migration state, that we had a record number of new job commitments come to the state of Indiana, an all-time record new job commitments with an average wage of over $28 an hour. When you think about our revenues where they are today, I wouldn't have predicted that in April. And the reason why that's happening is because of Hoosiers in 92 different counties, and to the tune of millions, who are resilient, who are hopeful, who are looking out for their neighbor, who understand the balance of and importance of lives and livelihoods. And I'm just proud and inspired, quite frankly, by the number of examples and of really heroic efforts at a time when, again, back in April and March and February, when this onslaught was coming at us, we knew flus. We had a flu playbook, but this is a whole new for our nation, a whole new endeavor for us all, and we stuck together. What I think you used the word disappointed. I mean, no one puts pressure on me like I do myself, and I look, when I close my eyes at night, I wish I could have done more. Dr. Box mentioned over 8,000 Hoosiers who aren't with us, who weren't able to celebrate these holidays. And this virus affects people in the strangest of ways. And when you hear about someone who leaves young ones behind and their spouse who had no underlying health conditions, who was in their 40s, or when you hear stories of two brothers with the same biological parents, one 21 and one 23, and one being affected much differently than the other, when you visit with folks in their 90s who are positive, who get through it with relatively little scare, maybe some of that's got to do with grit and perseverance itself, but it just, it's not disappointed. I just wish we had access to more answers. But the answer is getting through this together. The answer is relying on one another. So maybe you have your own personal observations to add to that.
Well, I think, Governor, mine are very similar to yours. I mean, my proudest moments have been watching state agencies that you've brought together to work together in collaboration and partnership to address this pandemic across the state. But also, most importantly, is those external partners that we have relied on so heavily to start producing personal protective equipment, or to help make testing equipment, or to help us be able to even get testing up and running in the state. Those things, those partnerships, those collaborations have been incredibly proud moments for me here in the state of Indiana, and they've been the bright spot to me that I look at every day and remind myself of those blessings. I think my lowest moments, my lowest times have been in trying to understand the difficulty that so many people have in understanding that there are simple, basic things we can do, like wearing our mask, that will decrease the spread of this virus, that could save not only your life, but also other individuals' lives. And that's really hard for me to understand, being a physician and a scientist. But I do understand everybody has different opinions on that, and try to respect that.
Abdul, I think you said you had two questions. I will also add, and Dr. Box just said this, I mean, I think every Hoosier should be proud of our small businesses that have turned and burned during this time of uncertainty and provided certainty for others, and our churches who have done outreach unlike ever before and seen their memberships grow virtually to the tune of, churches are now having a reach into other states and having a record turnout every, Sunday or whenever service is. And then to think about, we are home to not just those small businesses, but the larger businesses with a global reach that are helping on this global pandemic. When you talk about being, Roche's headquarters, or Eli Lilly and Company's influence with therapeutics and way beyond that. Catalent, who is partnering with these vaccines, these are based on Hoosier soil, and we should all be proud that no matter how small, medium, or large these businesses are, or nonprofits, our philanthropic community, oh my gosh, where would we be without our not-for-profits coming to the aid, rushing, foundations that have said, we normally wait till the end of the year. We're not. We're getting out there, and we're going to try to put this fire out right now. So with that, Abdul, you had a second part?
Just real quickly, Governor, have you figured out your state of the state address yet? How are you going to do all that?
It'll be less than Lincoln's address. Yes. The state of the state or the inaugural? You said state of the state? The inaugural. The inaugural. I answered that incorrectly. I cut you off. I apologize. The inaugural will be less than Lincoln's, which is 272 words if you're keeping score at home. The state of the state. Yeah, we'll do it safely, and we'll put the details out. But the length will be. We got a lot to talk about, and a lot to be hopeful for, quite frankly. What this pandemic has done, and where Indiana has truly shined, is it has brought the future forward. Technology was changing things at a record scale and pace before February, but what COVID-19 has done, again, Advantage Indiana through innovations, is it's brought that future forward so much closer and sooner than before, and you're going to see Indiana emerge, not just bouncing back, but stronger than ever on the other side of this. And I'll talk about that at the State of the State.
Max Lewis, WSBT.
Max, good afternoon. Thanks for joining us.
Good afternoon, Governor Holcomb. How are you?
Very good, thank you. Ready for the new year.
All right, so am I.
Yep.
I think this question is probably more for Dr. Weaver or Dr. Box as well, but two of the local health departments up here, both in St. Joe and Elkhart County, have both told me just in the past day that by now they had expected to receive doses of Moderna's vaccine at this point, and they have not yet. And they also said they were expecting to move into further vaccinations in about 2 weeks from now of non-frontline healthcare workers and other high-risk individuals, but they're sort of concerned about that at this point because they haven't received those doses. So is this a supply issue, or sort of what's the holdup on that? Why haven't they received those doses that they had expected to?
I think we'll want Lindsay to answer that one.
She's jumping at the bit.
Yeah, so we've been communicating with our local health departments on a regular basis right now, often several times a week, about the plan moving forward. So we are hopeful that, by the end of January, we are moving into different groups. And what we have been communicating with the local health departments is we do need them on standby and ready when we do open it up to a broader population of people. Because we don't want vaccine to just be sitting anywhere and not being used, we will only deliver it to them when we are ready for them to start vaccinating and when they start ready to be vaccinating. So like I said, we do hope that to be very soon, and we're working and hoping to communicate with all of you who those next groups will be and where those locations will be.
Brandon Smith, Indiana Public Broadcasting.
Afternoon, Brandon.
Afternoon, Governor. This is probably for Dr. Weaver again.
Okay.
My first question, I'll have a second question for Senator Braun.
Okay.
Dr. Weaver, you talked a little bit about, we've gotten reports that hospitals are now starting to give the vaccine to teachers, which would be jumping several groups that are sort of in line for this. Beyond just telling them, oh, please don't do that, what are we doing to ensure that the vaccine is getting to the people who need it most first?
Right. So again, several conversations with the hospitals about the allocation plan. We have weekly meetings, sometimes twice weekly meetings to keep them up to date with what the plan is. What I've also communicated to them is to have a list for the end of the day, that if they have any additional vaccines, whether it even be 3, and they can't find a healthcare provider at hand to put it into, that they go ahead and put the vaccine into people. But anybody that we've heard about it from, we've communicated with them. They understand the process. They have done things to make sure that they continue with the allocation plan moving forward. And we're going to continue to do that with education. I mean, and like I said, we've also started talking about who those next groups will be. And so we may see some people starting to move into the next groups as we communicate further. But right now, we are focusing on our healthcare workers and our long-term care residents.
And then my question for Senator Braun is, Senator, will you be joining your colleague from Missouri, Josh Hawley, in objecting to and voting against certifying the results of the election?
So Brandon, I figured you might be asking that or someone else would. Of course, I've been somewhat vocal on the fact that I didn't like the idea that we dismissed completely any of the investigation into irregularities, and I still stand on that. Josh Hawley has now created the situation where we'll all be on a roll call vote in terms of voting to certify the Electoral College. So I think what I'm going to do is look at the merits of what he's got underlying his objection. And I think there'll be many of us that look at that. And then, of course, regardless of whether you join the objection or not, there'll be a vote that we all will take. It won't, I think, succeed in what many that are frustrated with the outcome of the election are interested in, because I don't think it has any chance in the House. It will put every senator, every representative on record as to whether they believe that you should either, at least in places where there would be merits to do so, and it should be the prerogative mostly of state legislatures. That's a constitutional thing for me. When you get into the federal government weighing in on election results, there's, to me, some structure you need to adhere to. But I think it's going to keep that discussion alive, which I predicted it would, regardless of what happens with the states certifying their electoral votes or the vote that comes here on the 6th, because you still got half the country that, whether it's warranted or not, believes that at least some additional review needs to be made. Where that goes, I don't know. In terms of whether I'll join Senator Hawley or not, I have not made up my mind. I want to look at the merits of what underlies his objection.
Thank you.
Meredith with WLFI.
Afternoon, Meredith. How are you?
I'm good, Governor. Ready for 2020 to be over. Like
That's the theme.
I have two questions. One possibly for Dr. Box and the other one for Senator Braun. My first question is, I was wondering if you could provide an update on multi-system inflammatory syndrome in children. I know there was the first case in May. I was wondering if there's been any increases in that since children are back in school, and if there's any area that's the most prevalent. And then I have another question for Senator Braun.
Yes, we actually have documented 34 cases of multi-inflammatory syndrome in children in the state of Indiana. We've investigated about twice as many as that. It continues to be spread across the state. Oftentimes these children are hospitalized in larger children's hospitals, so oftentimes here in central Indiana, but also other areas. And to date, fortunately, all of those children have been released from the hospital.
And then Meredith, you had one for Senator Braun.
Yes, sorry, I wasn't sure if I was still
Yep.
live or not. Senator Braun, do you believe that $600 is enough for all Americans as well as Hoosiers when majority of rents are more expensive than that every month?
That's a good question, too. That's the other issue we're wrestling with now, and we'll debate that on the floor, I think, this evening. Senator Sanders from Vermont has said that he'll filibuster that very point until we have a straight up or down vote on an enhanced benefit up to $2,000. For me, if you're targeting this at small businesses, which I think the PPP is going to address that issue, when it comes to those who have lost their jobs, and I mentioned those particular categories, having an enhanced level makes sense. When you said all Americans, that's not the case anyway, because it is going to be income tested, $75,000, $150 per couple. And in one proposal, it's up to $2,000 for dependents as well. All of that we're going to discuss. I'm okay with enhanced amounts as long as it's aimed at the people still suffering from it. When you do it across the board, it takes the one proposal up to almost $500 billion. What I said earlier, something that I don't like about the place is we do this generally in a rush form, and we err on the side, we're borrowing every penny that we're putting at it. But to me, due to the severity of the crisis and the disproportional impact it's had on those still unemployed, that an enhanced amount, in my opinion, would be okay, but targeted. If you're working, if you have not lost your job, I think you'd have to scratch your head why that would still be sent out to you. To me, it ought to be targeted to people that have not gotten back on their feet and maybe even have that kind of support done again until they are back on their feet. That's a much different way of looking at it than what we're going to debate this evening.
Yeah, and appreciate that approach and that targeted approach, Senator Braun. And, this is a kind of a K, it's been described as a K-shaped recovery, not just here in Indiana, but around the country. And we want to make sure that help that you're providing focuses rightly on that leg of the K that is still down, or for all the gain that we made over the last 4 years and for the loss for that lower leg. That's where it needs to be targeted. And when we start to see those have-nots getting back to the have category, that's when good things happen. Go ahead, Rachel.
Whitney Downard, CNHI.
Afternoon, Whitney.
Good afternoon. I have a question for both Senator Braun and for Dr. Weaver.
Okay.
I wanted to ask Senator Braun about his plans to get the vaccine and where he might see himself in the line and efforts to get the vaccine distributed to the states.
First of all, on the subject of vaccines, if there's one silver lining to such a terrible challenge and what has happened with this disease ravaging the country, the formulation of a vaccine and the time is amazing. And I think that is a tribute to that entrepreneurial component that is in part of healthcare. As you know, I've been the most outspoken senator on reforming healthcare in general, but here they have shined. And I think the fact that there was the accommodation to push that kind of dynamic gives us the only true hope to putting this in the rearview mirror. I will not jump in front of the line to get a vaccine. I recommend that everyone in that order of vulnerability gets it. And I think if you do not have any reason in terms of an adverse reaction or something in your history that would say otherwise, everyone should get it when their time comes because it's got the highest efficacy rate of hardly any vaccine that's come onto the scene. So yes, and I think it's a tribute to the ingenuity, entrepreneurialism, and a broad, dedicated effort to have that hope here unfurling right in front of us. And I'd also add that if there's any issue with what the federal government is doing in terms of getting allotments, we want to hear about that as well.
Whitney, did you say you had a question for Dr. Weaver?
Yes, I wanted to talk more about how the vaccination plan for long-term care residents ties into the overall vaccination plan. You know, we've got reports of teachers jumping in line before, I don't want to say jumping in line, excuse me, teachers getting vaccinated before long-term residents. You know, I assume that there are plenty of long-term residents across the state who would be willing to get vaccinated, or even elderly workers. You know, how does this tie into the state's overall plan, or is it run exclusively through CVS and Walgreens?
So CVS and Walgreens have partnered with Operation Warp Speed for a federal program to provide vaccinations to our long-term care facilities. So where we do come into play is that it comes out of our state's allocation. So we have vaccines that are specifically earmarked for them. The good thing about this is that it doesn't require moving, a lot of those residents who are, bed-bound or wheelchair-bound, moving them to another location to get vaccine, that the pharmacists are actually going into the facilities to provide the vaccine. So they still have vaccines set aside for them, and they have assured us that they're going to move through the skilled nursing facilities here in just the next several weeks. And we, as we get more information and updates on that, we will absolutely share it with you.
Our final question is from Brock Turner with WFIU.
The final question of the year, Brock. No pressure.
I will try and meet the call here. I have two, actually, if that's okay. One for Senator Braun and then one for you, Governor.
Okay.
Senator Braun, could you just talk a little bit more in detail about, specifically, what things you're looking for to certify the Electoral College results? I mean, have there been any instances of fraud that you think, haven't specifically been fleshed out that you would like to point to?
A good question. I think because if you've obviously been watching events transpire, you'd think that there would not be very few courts have taken up the standing or hearing of what's been presented. But on the other hand, I think when you talk about our democracy, I think there are two components to it. There should never be voter suppression. You should encourage people to vote. On the other hand, you want to make sure that when that does occur, it's fully in line with whatever the laws are in a particular state. And obviously, that's the bailiwick of the states, not the federal government. I think when you take so many places where there was such an influx, paper ballots, mail-in, a lot more absentee ballots. There are certain guidelines that you use normally. And to me, it's worth the effort to make sure through some type of audit so that you can allay the concerns and fears of half the country that everything did work well. And I think there was a commission that James Baker and President Jimmy Carter stressed with 80 recommendations only 15 years ago. So I think, and my point all along is it probably wasn't systemic. It may have very little impact on what transpired on November 3rd. But if you dismiss it reflexively or completely, and you're not willing to do what I would consider would be normal in your best interest auditing, especially in places where people have concerns, it's not going to set the stage for people being confident in the future that you both, number one, give everyone every opportunity to get out to vote. And then once you do, that your ballot is legally counted.
And then Brock, you had one for me?
I did, yes. I know you don't like looking back, so you could look ahead. What are the things specifically related to COVID-19 moving forward into 2021 that most concern you and that you think, are going to be the most important things that we figure out?
I think the thing that most concerns me and my colleagues around the country is the understandable fatigue. We've been at this for almost a solid straight year, and the intensity is as great as it's ever been. And the vaccine is absolutely the light at the end of the tunnel, but that vaccine has got to be complemented with vigilance, which is not just a rhetorical word that will protect us. It calls for action. And we will, it's not an exaggeration, save lives if we remain vigilant. And if we each do our part, and even more maybe than we've done in the past year, it will play to our strength We're a sports fanatical state. I don't know of too many governors that'll be watching 3 bowl games in the next 4 or 5 days. We will field 3 teams. And what I've learned, whether it be on the court of the field or in the rink, is teamwork. And that is where we see progress being made, is when we all recognize our role in this time and in this place. And we will get through it. I'm very optimistic. It's just at what cost along the way. And so that's why we continue to appeal. We try to lead by example. We try to be transparent. We try to give you the facts as straight as they are. And that's my biggest concern, is that folks don't say, well, there's a vaccine out there, I don't have to worry about this anymore. And we see daily reminders to the tune of over 100 today, deaths reported. And it's happening all over the world. And so I do choose to look forward, but that's not that's not a cavalier attitude to say I'm not going to learn from my past actions and where I may have come up short. What I don't want to do is repeat that, and that's what we ask of everyone. And with that, if you do need help, remember what Dr. Sullivan said, and that is there are folks who want to help. There are folks who are here to help. That is their purpose and their passion in life, is to help you get through this tough time. It's as easy as calling 211, and you will find someone on the other end of that line who can make all the difference in the world for you and your family. Happy New Year.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.